Welcome to the Uniform Services Constipation Action Plan Provider Familiarization video. This plan was developed by the Pediatric Gastroenterology Division at Walter Reed and is being distributed amongst our patient-centered medical home for your use in our implementation science study. So let's get started. Let's imagine that we have a patient, Joe Snuffy, who was born on January 1st of 2015. And his identification number, his DOD ID number, is this. And the provider who's filling it out today is me. And I could type in today's date, but I've added a simple click button for you and it automatically outputs it. And let's say that this patient is 20 kilograms. Now, this action plan is built in with 4 sections. There's a clean out, a good, which is their everyday maintenance therapy, a bad for a step up, worsening symptoms, and worse. Now, each of these different sections comes complete with a drop-down menu of medications, some being on our formulary and some that the patient might have to purchase over the counter. And you have the ability to say how much you want them to get and whether that be once or twice, or you can even use drop-down menus for this and any other instructions that you want. And that's how you can free text or take advantage of some of our low health literacy built-in options for these medications. Now let's say that you don't necessarily have time to create this from scratch, or you want to discern what is the PHGI recommendation for this age and weight of a patient. You could use the partial reset button. It allows you to keep all of the demographic information you already input. And let's say that young Joe needs a clean out and you want to figure out what his maintenance, his yellow, and his red zone therapy should be. You have 4 checkboxes that are available to you. The boxes that are on the left will allow you to click and then it'll fill everything in for you based on the gastroenterology clinical practice guideline for constipation and what we here at the Walter Reed PHGI division have decided is the best recommendation for therapy. On the other hand, if you use the red boxes, the rightward boxes, you must pre-select your medicines first and then check these, and it will output for you the dose, the frequency, and any other important instructions. So let's give it a try. So for Joe, let's say we want him to have a clean out. Click one left box, and it outputs everything. As you can see, we're recommending that these patients be started on stimulant therapy, and that if they have a clean out, their clean out consists of an osmotic laxative and a stimulant therapy. Now, let's do a partial reset and decide maybe Joe doesn't need a clean out, but we do want to follow the PHGI algorithm for the remainder of the sections. We could click this left button. You can see how it outputs the same. Or, let's say that for whatever reason we don't want to use Miralax, we want to use milk of magnesia or Dulcolax for the clean out. It outputs there. Next, we'll select our medicines for maintenance therapy in the yellow zone. It's usually simplest to make sure that the same medicines you use in order to perform the clean out are the medicines that you use for your maintenance and step-up therapies. It really ends up being easier on the patient with fewer bottles for them to keep track of. So we've got our medicines selected here. We hit the right button. There it is. Whenever you default the plan, it does make the red zone default to call your clinic nurse line. You do have an empty box here in which you can put in your clinic. Maybe that's the peds subspecialty clinic. It serves as a doctor's note if your patient is for any reason going back to face-to-face school. And that's really it. Now let's say for any reason you needed to edit these recommendations that we provided you. We have built in the feature so that you can change anything that you want just by typing it in. I hope this is useful and efficacious for you and for your patients, and thank you for watching.